Okay, good morning, everybody. I'm really excited to see so many people. I had no idea how many would join us, and so I'm really excited to see all of you, at least your faces, and feel like we're a little bit close. Sometimes we haven't even had this many when we did it in person, so this is really nice. Hi, Mary. I'm Dr. Clifton Cole, and I'm board certified as a family practitioner. I had 27 years experience in a private solo office, and about 2011, I closed that office, and now I work with one of the hospice agencies locally, and then I also do some work with long-term care patients at skilled nursing facilities and assisted living facilities. So I'm also board certified in hospice as well. And so if you have any questions about hospice or palliative care, I can address those as well. But my experience in the office, particularly the last 13 years that I had in my office in Palm Springs, I had a number of patients with different types of dementia, and so I have some experience with that. As Pat said, I like to just give a little educational thing to start with, but mostly what I enjoy is the questions and answers, and so we'll start now. When you're thinking about different types of memory problems, there's different levels. We have cognitive impairment all the way to, advanced severe dementia. And there are certain medications that are very helpful depending on which type of dementia and at what stage. At some times, the medicines are actually no longer helpful and can actually have problems with side effects. So we can talk a little bit about that as well. But when we're thinking about dementia, there are basically four major classes is the way that I describe it. The most common, of course, is the Alzheimer's type dementia. And physiologically, what happens is little proteins that are sort of like, think of it as gum, get in the way of the way the nerve conduction happens in the brain. So think of it as like a jumble of wires in your brain, and when there's gum between the wires, the messages don't get through as fast. So it takes longer to think of certain things, and sometimes it's just too much. So that's primarily the Alzheimer's type dementia. There's two types. One was classically described by Dr. Alzheimer's way back in the early 1900s. And what he found was that there were a small number of patients who were young, but they were acting like senile older people. And so he was the one that called it at that time pre-senile dementia, or you get dementia before you get old. That started then, looking into it, and Alzheimer's, of course, as you know, can come at any time with these physiologic changes. The other major type of dementia is something that happens when there's a problem with the arteries in the brain, and it can come from a big stroke, or it can come more commonly from what we call TIAs, or little tiny mini strokes. And that comes also at any age, but as people get older, all the arteries start to get a little bit clogged up and stiffer, and so that's typically more for older people as well. Then there's the type that are neurologically based. So there are certain chemicals within the brain, and as they do their balance and their thing, sometimes there's an imbalance. And the most common one that you probably know of is Parkinson's disease, and that initially causes problems with the way the brain tells the muscles to work, and then as it progresses over a 15 to 20-year process, it starts to affect the way people think. Other neurologic problems also can present with some types of memory problems as well, you know, such as ALS, multiple sclerosis, and some of these other kinds of neurologic degenerative illnesses. And then the fourth type is a whole mixed bag of a little of this and a little of that. And it's not any one specific in the fourth type. And the way I've listed them is also the order that they're most common. Certainly Alzheimer's is most common. Then the vascular comes after that. And then the neurologic is, you know, maybe 10%. And then all those other ones in class 4 is 2 to 3%. Each of those, because they are caused by a different reason, can have different treatments. And then there's the part where it's a little of one and a little of the other, which we call then mixed. And so you can have a combination of, say, Alzheimer's and vascular. And so all of those are treated individually in what's best for the patient. And so when we're looking at treatment options, what I've always said, whether it's, you know, memory problems or heart or anything, first we get an accurate diagnosis, because when we get an accurate diagnosis, then we know best what the treatment should be. And so getting an accurate diagnosis is important. Sometimes it requires blood tests, sometimes it requires just different physical examination, and sometimes brain imaging like a CAT scan or MRI can be helpful in showing those things. So that's the basics. If somebody has questions, we can start in now with questions. If you want me to talk about something additional, Pat, do you have any other topics I should address before we move to the questions?
No, I know one thing that comes up a lot, and maybe you can talk about this, Dr. Cole, is it seems like most families that come to us with questions are reticent to have a diagnosis. So when we ask them, you know, have you been to a neurologist or something like that? No, we haven't done that yet. And I think one of our challenges that we've been trying to do is talk to folks about early diagnosis because of the benefits. And I think most people, they perceive it as they don't want to know about it because there's no cure, so they avoid that process. But in reality, there are more pluses than minuses. And so if you could speak to that, I think that'd be helpful.
Thanks. Okay, yes. As with any medical condition, the earlier you know what's going on, the better you can be treated, because all medical conditions are better treated early when they're not as bad, shall we say. But so think about, you know, a heart disease. Do you want to wait until you have a big heart attack, or do you want to know that you're in the early stages of vascular problems and there are medications that can prevent things from getting worse? So there's, in medicine, there's a couple things. There's primary prevention, which is you figure it out before something bad happens and you do what you can to treat it to prevent that bad thing from happening. And then there's secondary treatments, which is after the bad thing happens, now what are you going to do to prop up what's left and, you know, slow down the roll, shall we say. So particularly with vascular dementias, knowing that there's something going on with the arteries in the brain, there are, just like there's treatments for arteries in the rest of the body, whether it's in the heart or the legs, there are absolutely treatments that can prevent continued deterioration, basically. The same thing with the Alzheimer's type dementias. There are yes, you probably know there's 2 major classes of medications, and both of them are designed to be used early. I mentioned that a little bit earlier, that basically the treatments are early on, and the major point of the treatments is to help people be more independently functional. When we have later stages and people are started on medications late, they can help a little bit, but not near as much as starting early to do the prevention. I kind of describe it as, imagine you've got a marble bag with 30 marbles, and there's a hole in your marble bag. When the marble comes out, you can't put it back in, but you can sew up the hole to prevent loss of further marbles. And so this is why early diagnosis and an early accurate diagnosis is so valuable in designing the right kind of preventative treatments to keep things as good as possible early on. I imagine everybody, I don't know if anybody here is in that category that, you know there's something, but you haven't really gone all the way to having a full workup or accurate diagnosis. But if that's the case, then I highly recommend that you work with your primary care doctor to pursue that. And do we have lists of doctors that work with us that patients can
Yes.
be referred to? So if you're unsure about the doctor you have, or you're looking for a neurologist and your primary is a little reluctant or something, our association can help you negotiate the very, very complex, complicated medical field, the way things are set up now. I was around in the days when it wasn't so complicated. So, but we are here to help you. And a lot of what I ended up in the later part of my practice and still do now, and is negotiation of the complicated medical systems that we have. It gets more complicated, it seems, every couple of years. But we are here to help you and be a resource to you. So please reach out and ask for what you need, because you might be surprised how easy it is when somebody else is holding the flashlight to find your way in the dark. So anything else, Pat, that that it's common for me to address before we do questions?
No, I think we could open it up for questions.
Sure. Okay, so this is my first time being sort of a host of a Zoom, so I'm going to do the best I can to, wander around my screen looking at all of you and answer your questions. I don't know how we're going to decide who's asking the question. Is that you, Priscilla, or who does that?
Well, we'll help you out, Dr. Cole.
Okay, good.
If you would like to ask a question, go ahead and unmute yourself, or you can raise your hand and I can try to unmute you. But okay, Hannah, would you like to go ahead and start? Go ahead, Hannah.
I'd like to get some more information on atrophy of the brain, which is what we're dealing with in our household.
Okay.
Thank you.
So atrophy of the brain. So when you is typically seen on an MRI or a CAT scan, and what it is basically the brain starts shrinking, and that is one of the classic type senile, meaning old, not crazy, types dementias. And that is typically related to vascular. It's in that category. So, doing all of the kinds of things you would do for vascular disease prevention may be helpful in slowing the progression of cerebral atrophy or shrinking of the brain. Does that what you were wondering about, or can you something more specific?
Yeah, sort of, and how it progresses, or so it's not an Alzheimer's, but it's a vascular dementia related to.
Category of vascular, right?
Thank you.
And so how it progresses is variable, just like any types of memory problems are variable. We have general statistics, and general applies to most of a bunch of people, but it could be 0% or 100% because it's only one person you're talking about. Again, that's a time-related thing, and with any of these types of situations, it seems near the end that it came on all of a sudden, but as you look back, it's been brewing for quite some time, you know, like a 15-year process. And the curve, let's see if I can do this, does not go straight line down like that. It's not like this, it goes more like this, slowly, slowly, slowly. And then when you get farther near the end, it takes a turn and then seems to drop off more quickly. And generally with vascular and Alzheimer's type dementias, it's about a 15-year slow process from the start. But with vascular, there's also all of a sudden something bad happens, boop, then you drop down to a lower level, and then the curve continues, but at a lower level. Particularly if there's a stroke or some kind of specific vascular, what we call event, or something happens.
Thank you.
Mm-hmm.
All right, thank you. Now, Helen, I believe you had a question. You just have to unmute you. There you go.
Am
Hi,
I
Helen.
I'm unmuted? Okay. Hi. John has been taking DonnaPiso, which I think is Aerocept,
Correct.
since he was diagnosed, which was 2 years ago.
Okay.
And at that time, the neurologist said about the Aerocept or the DonnaPiso that it had been found to be useful for 2 years or so, but not a whole lot longer. But John has been doing really well. And my question is there any reason not to continue as long as he's doing so well? Is there, in the long run of DonnaPiso, are there side effects that we should worry about, or can we just continue it comfortably?
The bottom line to your question is continue it comfortably.
Good, thank
Okay.
you.
Good.
The explanation around that is, remember when I mentioned a little while ago, there are statistics that show generally what happens, and usually what happens is after about a couple years, the disease has progressed, and so then it's no longer helpful. In your case, in John's case, hi John, it looks like it's being very helpful, and there's no reason to stop it just because it's been 2 years. That he did give you accurate information that those medicines usually are statistically helpful for a couple of years, but there are some people on them much longer than that. And it seems like you may have started earlier rather than later. So mixed into that study of only 2 years, well, when did they start? If they started 6 years into the illness and it's only good till year 8, then it's 2 years. But if you started 1 year into the illness, you might get 7 good years out of it.
Good.
So
that's good to hear.
Right, right. Now, the other side to that is, when do you stop? Well, you stop it if it's no longer effective, and there may come a time when it's not. But the other thing is usually the time to stop is if somebody starts experiencing side effects. And there are, you know, a number of side effects that can come up, but those are particularly for people with more advanced Alzheimer's with dementia. And so then the side effects are worse than the little bit of help that it's basically not giving anymore.
Yeah.
The hard part with that one, or Namenda, which is the next add-on for the next step, is that when we get to the point of stopping those, now what are you going to do? Because there isn't anything else yet.
Right.
And so sometimes people are reluctant, but I don't have anything else to go to, so they don't want to stop it. You know, and that becomes a very individual, personalized discussion with your doctors at that time. But at some point, it may be that the side effects are worse than the benefits. Particularly problems with urination, being dried out too much, lightheadedness, and sometimes if there's the type of memory problems that include a little bit of agitation because we get frustrated and so on, those medicines are designed to activate the brain. Well, if what you're activating is the agitation, then it makes it worse.
Right.
So I have seen that occasionally, not too often, but I have seen it, and we pull back. And what do you know? People actually function better and feel better, and you know, they're happier because they're not being overstimulated to the bad part, the negative thoughts in the brain that can happen because the wires are all crossed.
Thank you.
Thank
That's
you.
very
Thank you.
helpful.
Good.
Thank you.
Thank you.
Carry on,
Eddie?
John.
So just to add to that, Jim has been on Aerocept, it must be 5 or 6 years. When we first moved here, he was put on it and he did fine. And then for some reason, we thought because he was doing fine, he should go off it. So he went off it. But then when we started with the new neurologist, in fact, 2 different neurologists, they both said stay on it. So he's still on it, 10 mgs or whatever. And I don't notice any side effects except he complains about fatigue, but fatigue is worth it if the brain is getting some help and staying. He's kind of been at a status quo. I don't see any great decline, but I missed the very first part of your talk, but you said early detection. And I have to say that I'm very fortunate that even not to my knowledge, maybe 8 or 9 years ago, Jim, we were living in the East, he went to New York City to Mount Sinai for a test just on his own because he thought he was forgetting here and there. I didn't even know about it until he had it. And they did diagnose that he had some short-term memory loss and advised when we moved to California that he should see someone here, which we did, Dr. Hadarian, and then, you know, we've been carrying on since that. So I think maybe part of the reason that he's doing okay is we caught it very, very early, I think, you know, in the early stages. And he seems to be holding his own, except for some physical, you know, needing a walker and stuff like that. So, but I'm staying with the Aerocept until, you know, whatever, till I see something worse, Helen. So anyway, that's my story.
Well, I want to just thank you for telling your story because you've just said very personally in your own words, your experience, which was what I was saying, that if you get tested early, you get an accurate diagnosis early, those medicines will benefit longer. You've got a neurologist that you're confident in and has recommended you stay on it. You're not noticing any bad side effects or anything that would trigger a reason to stop. So carry on. It's what you're doing. And
Yeah,
as a third opinion, yours and the neurologist, I agree.
good. Thank
You're
you.
doing well.
Thank you.
Thank you, Betty. Do we have any other questions? Hannah, go ahead. Unmute yourself. There you go, Hannah.
Yeah, in relation to speaking about the medications, my husband was not prescribed anything for the brain atrophy. Would these medications therefore not be appropriate for him?
Generally, the Aerocept and the Namenda are not typically beneficial to people with basic brain atrophy. Probably not. That would really be if there's some Alzheimer's mixed in with that. As I said, you know, sometimes it can be a mixed type dementia, then that might be helpful. And so that's really a very patient-specific personal question to ask his doctor who's doing all the testing and that kind of thing.
Thank you.
I'm not too optimistic about them, to be honest, but it's certainly a very good question to ask. Oh, I forgot to tell you my rule about questions. Good questions are the ones I already know the answer to. So feel free to ask me any good question. Ask me anything you want. If I don't know, I'll say, I don't know, but we'll find out together. Anyway, who else has a question or a topic you want to talk about? Story to tell me.
Dr. Cole, are you seeing any patients outside of the nursing home or the hospice?
You mean privately?
Right.
Independent? No.
Okay.
My practice is limited to my hospice agencies that I work for, and then also I see patients for one of the medical groups in several skilled nursing facilities, and I have 2 little board and cares where I know the operators there, and I do see those patients privately, but they live at the board and cares. I do not have an office anymore. I'm a house call doctor now. All I do is house calls. But I don't really have a private practice. I'm not set up for that anymore.
Okay, thank you.
All right, do we have any other questions? It doesn't look like it.
I want to ask Dr. Cole to share another a regimen that you have every day, Dr. Cole, that when I first heard you talk about this, I've tried to incorporate it. I'm not up to 42 ounces, but I think for our families that are looking about things they can do preventatively, even if they have a diagnosis, maybe you could talk about a little bit about some things you do that you find helpful.
Well, the body is, 2/3 salt water, and the brain's even more than that. So every day I start with, and I've already done it, is one of those drive-throughs. You get the gigantic size, 44 ounces. So every day I have a little bit of electrolyte powder that I get online, and I mix that with 44 ounces of water. So I start my morning with 44 ounces. There are studies that show when somebody is well hydrated, which is at least a half a gallon of water a day, your blood is a little bit thinner, it's a little less sticky, and so you have a less chance of stroke, which goes to the vascular type of dementias and maybe the brain shrinkage as well, the cerebral atrophy you were asking about. So yeah, I do that every day, and usually I do 2 of them just because I like it, and I know it's really good for me to stay well hydrated. The other thing is actually some sort of activity, doing something physical, and then even if it's walking or chair exercises. I actually have I'm 66 in 2 months, and I started a routine a couple years ago of mobility. And so I do this routine. It takes me about a half an hour, and I do it while I, start boiling the water for my coffee. And then once the coffee's gone, then I'm making my electrolyte powder water. And while all that's going on, I have my little sets of mobility exercises. And so that is something people can do. Chair exercises, anything that it doesn't hurt is good to do. Staying active is very helpful. And then also doing some sort of, whether it's a video game where you have to use your brain, whether you like words or numbers, there's crosswords, there's Sudoku for number people. I'm more of a numbers person, but, doing something, I'll share a slight personal story. My grandpa used to brag about how he would name all the presidents backwards and forwards, and he'd do the same with like whoever was the Cy Young Award or something with baseball or football. I don't remember what he was talking about, but it seemed kind of nutty at the time. But now as I'm, know more about it, it's like, that's what that guy was doing to make sure his brain stayed stimulated. And he died at 91 with absolutely no problems with his memory. So.
That is fantastic. Dr. Cole, I'm sorry, could you repeat what it is that you mix with your water? What electrolyte powder was that?
It's called Ultima.
Okay, and where do you? I just have one of our members asking, where do you get that?
I get it online.
Okay.
Just a second.
I think he's gonna.
They,
You're right.
Priscilla.
Major qualification. I'm not vouching for this or saying this is good for you because I don't know you all. But if you want to know what I use, is that backwards for you guys?
We can know.
You can do a screenshot.
No, but
if you want.
it's Ultima.
It's Ultima, and I get it. Sometimes I get it through Amazon. Sometimes they're not the cheapest, so I get it from one of the competitions that pops up. But I think if you just Google that, but that's what I do. It says put this little tiny scoop, which is like about a half a teaspoon or something, in 12 ounces or 16. I just put it in 44 because I need the water more than I need all this, salt powder. And for me, I like the lemon. I've tried the orange. I tried the raspberry. The other ones seem to have color that gets all over the counter and whatever, and the lemon doesn't seem to do that. So that's what works for me.
Thank you. Francis, did you have another question? Or was that it? You have to unmute yourself.
Dr. Cole, have you ever heard of Barlean's fish oil, specifically the key lime?
I'm sorry, that was a little bit muffled. Have I ever heard of what?
Barlean's, B like in boy, A, R like in Rebecca, L, Larry, E, Edward, A, Apple, N, Nancy, S, Sam. Barlean's fish oil. Clocks has it, and I get it at Amazon.
I have not heard of that.
I'm gonna go get the bottle and show it to you.
They do say fish oil is good for your cognitive.
Yeah, I just don't happen to know that particular brand, but you know, it sounds like it's a, that looks like probably a good product. Mm-hmm.
Do you recommend CoQ10?
Who asked that question?
Mary did. She asked if you recommend CoQ.
The studies don't really show that it is particularly helpful. Some people might find a benefit, and I don't think it's at all dangerous. So if somebody wants to take it, I certainly wouldn't tell them that they should stop. It doesn't seem to interfere with too many other prescription type medications, like some over-the-counter supplements. So you have to be wise about that. But the studies don't show it's particularly helpful. But if you've got a lot of money and you want to make the company rich, go ahead and buy it.
It's very expensive.
Yeah, that's
why I don't want patients buying it if it isn't beneficial, because it is so expensive.
You're right, Mary. It is typically expensive, and it really is not beneficial. And a lot of times those companies know how to trade on hope. When medicine doesn't have anything, people are like, well, I'll try this and maybe that'll work. And usually my rule of thumb on any of those supplements is go ahead and try it for 2 months. If you don't notice a particular improvement after 2 months, it's probably not going to work, and don't buy any more. You know, hanging on to something even though it's not working is not good. Plus, you know, your body has to metabolize your food, your medications, and other things. And as we get older, one thing we need to do is keep putting a bunch of stuff in our system and make our kidney and our liver and vascular system work to deal with that when they're just trying to keep us moving along and going forward. So I'm not a big fan of Q10.
All right, thank you. And do we have any other thoughts or questions for Dr. Cole? All right. Well, I want to thank everybody for joining us again today. Thank you, Dr. Cole. That was very helpful. And this video will be available. If there's anything that you missed, will be available by Monday on our YouTube channel. I'll send you a link, Dr. Cole. And
thank you. My mom will appreciate that.
Our website.
My mom's 86 and she doesn't know how to do Zoom, so she couldn't join our meeting today. But now I can send it to her on video. So you all don't know this, but my mom gets to meet you all.